Welcome to Tea with Tanya. I'm your host, Tanya Ambrose, an average millennial navigating life as a maternal health professional, nonprofit founder, and grad student. Join me in the tea tasting room where we spill the tea on finding balance and promoting positive living while doing it all. Hey friend, welcome back to another episode of Tea with Tanya, your go-to space for real, honest, and transformative conversations about health, wellness, and promoting positive living. I'm your host, Tanya, and today we're diving into a topic that I know many of you have questions about, and that's aesthetic medicine. We're going to be talking about skincare myths and what you need to know before considering any aesthetic treatments. And let me just say this. We're all about whole woman wellness over here, and that means understanding that skincare isn't just about vanity, it's about self-care, self-confidence, and your overall well-being. Because when we take care of our skin, our body, and our mind, we show up in the world feeling our best. And that's what this conversation is all about today. I am super excited about this guest because let me tell you, we connected over an Instagram thread, and the podcast recording is a reality by way of us just communicating over the last several weeks. So definitely I'm looking forward to this conversation because we kind of talk about whole woman wellness and not talk about everything that encompasses that, which is also skincare. So to help us break it all down, I'm joined by Dr. Nicole, who specializes in skincare. And she's here to share the real tea on aesthetic medicine, what works, what's a waste of money, because we know how that is, and how we as Black women can prioritize skincare in what truly serves us. So hey, Dr. Nicole, how are you?
Hi, thank you so much for having me. I'm very well, thank you.
Guys, can you hear her accent? Do you hear that? Nevertheless, we're very nosy people here, as we call it, in the tea tasting room. So give us all the tea. Tell us about you and what got you into this career field.
Thank you for that fabulous introduction. Like I said, I am a doctor and I do specialize in, medicine as well as aesthetic medicine as well. I've been a doctor for, oh my goodness, I don't even want to count, but probably about 5, maybe 6 years now, and started just in the general medical field in internal medicine, and have always been into skincare and beauty and how amazing it is to help others feel beautiful. So I sort of ventured into aesthetic medicine, started learning a bit more about it, took some courses, and that really launched me into starting my own business and helping women feel their best and social media and all that crazy stuff. So yeah, really loving it.
So let's start with the basics. What exactly is aesthetic or cosmetic medicine? Because when I'm thinking about it, I've been doing my skincare and everything. But you see things on social media, we don't necessarily pay attention to what it is. Because, we have a lot of fluff out here in the social media world. And when we have actual evidence-based information, we tend to not necessarily paid any attention. So to those of us who are listening, who are novice in this aspect of things, what exactly is cosmetic and aesthetic medicine and how does it differ from dermatology?
Yeah, so I always think that cosmetic and aesthetic medicine is a little bit nuanced depending on your location. So in the UK specifically, we don't really have dermatologists that cater to the private market. If you go and see a dermatologist in the UK, you're seeing it on the National Health Service, which is, we'll not get into that. But you're only going to be seen for specific dermatological conditions such as psoriasis or eczema. If you want your skincare helped, you're not going to get any help with the NHS dermatologist. So there's obviously a group of us doctors who have carved out a niche of aesthetic medicine where you have the world of injectables, you have the world of skincare, and we sort of fill that gap and that need that is really lacking, especially in the UK. And I do think there are some other countries that have a similar thing as well, if that makes sense.
Yeah, it doesn't. That's interesting because I think about when we're hearing about cosmetic treatments, we're thinking about Botox, how can we essentially, there's a lot of curiosity, I would say, around cosmetic treatments. Because for me, and I'll speak about my personal journey, I suffer from chronic migraines. That's just my life. It's part of who I am in this life at this point. And I've now failed 2 rounds of medication, essentially. And I'm being told my next step would be Botox in order for me to, reduce or even stop the migraine. So what is one thing, me being me, I'm thinking when I was first told this, and don't judge me, doc, that I say, black don't crack. I don't need Botox or these different things to make my face look however, because again, I got the juice, from the Caribbean and everything. But after, that's all we got. That's what that was my honest thought, to be honest, because I never knew that you can get Botox to stop a migraine. So what is one thing you wish people like myself would understand as it relates to before we even considering any sort of cosmetic procedure? Because I asked that question because I'm thinking when I hear Botox, you don't want to have any wrinkles. You want to look young for the rest of your life. That's my interpretation of that. But then on my end, hearing that the Botox will essentially slow down or stop your migraine and you got to get that injection. I think she was telling me every 3 months. So what is one thing that you think we should think about before considering any cosmetic treatment? Because I'm thinking Botox and migraine don't go together, but there are people out here who are doing it essentially for one reason, whereas I have to. So I'm trying to ask, is there a negative effect of doing Botox just for a cosmetic reason versus a medical reason? So talk to us about that.
Yeah, that's an interesting point, actually. So first on the Botox for migraines, first up is fantastic. I do that all the time for a lot of my patients. Yeah, it's really effective. And I had one girl who came to me, young girl, been suffering with migraines for her whole childhood and her young adult life, and debilitating. I mean, migraines are debilitating. You know this, right? And she was getting a migraine, something crazy, like twice a week. And I just thought, poor thing. So she came to me and she literally texted me 2 weeks later and was like, "You've actually changed my life." And I was essentially tearing up a little bit because it's really sweet of her to message that. But she now is just never ever misses an appointment. She's always there. It can be life changing. And there's other applications we have with Botox specifically that you can use medically. Different things, weird and wonderful, that can really help, that people have been doing. But obviously there is the cosmetic side. But the way I think of Botox is it is a drug. I personally think whether it's cosmetic or not, it is a medical procedure. And I think that with a lot of the cosmetic procedures that we have, either way, there are risks involved, okay? There are benefits, but there are risks, and you need to take that into account because it is a medical procedure. So whatever the reason, whatever the outcome, it must be handled with care and with thought, and you must find a practitioner who's going to respect this medication and the risks, essentially. So I think the most important thing stepping into any cosmetic procedure, whatever the reason, is just making sure you're aware of the risks and the benefits, and you find someone who's qualified to complete the procedure.
No, that makes sense. Because when I heard that, I was like, "Girl, I don't need Botox." I may need it at some point in time. I can kill two birds with one stone. Who knows? But that's good to hear from you that it actually is effective. Because I did some research, yes, but I was still on the fence because I'm like, I've never just heard migraines and Botox in the same sentence. So I'm glad you cleared that up for me. So now I have to ask. What is the biggest mistake you see people making with their skincare or treatments in your work?
Just generally with skincare, biggest mistake, or maybe a trend that people do.
Yes, we'll do both because I'm seeing Korean skincare now, and I've seen putting period blood on your face. I've seen it all on social media. I'm the period girly. By way of my nonprofit, but I'm like, I've never really seeing that. Then I'm seeing someone say, "Oh, you got blood from somewhere else." We saw that with the Kardashians even doing that.
Yeah, the
again,
vampire
so that they can maintain that level. Yeah, the vampire. Yeah. So talk to us about that. Is that even a thing? The trends that we're going through on TikTok is, everything we talk about is, I started on TikTok. It's never, I went to Google or Reddit. It's TikTok now. So we're in that world. So talk to us about that.
Yeah, we need to be really careful with social media and skincare and beauty because we can be quite misled sometimes, which is, really a shame. I think the thing that gives me the ick maybe the most that I see on socials is people using food and using that as skincare, especially because food goes bad, right? And people are making these masks and then they're not storing it properly. They're storing it in there for weeks and they're using it. And I'm just like, the same way that you wouldn't eat that, we can't be putting that on our face now. And I just think we have very effective skincare out there on the market that has been researched. We don't really need to be putting food on our face with all sorts of bacteria and things like that. So that probably gives me the biggest ick, I'll say. But in terms of trends, I don't generally like trends because a lot of the time there's no scientific basis for them and they're just here today, gone tomorrow. So you just have to be very careful. Always enter social media with skepticism, whether it's skincare or otherwise, but especially when it comes to something like your skin and your health, there's a lot of people just trying to get views and clickbait out here. So, yeah.
No, that is true. And I want to shift a little bit for skincare for Black women, because you heard me say earlier, oh, Black don't crack, and, we do age beautifully, which we do. Don't get me
We
wrong.
do.
But I
We
feel
do.
like sometimes that statement makes a lot of people, a lot of Black women think that they don't need to take care of their skin at all. And I've seen people on social media say, oh, I just use soap and water, which again, I'm sure is fine. Because right now, here, my dermatologist has me on a regimen where, which is so strange. Let me ask you, Doc. Then again, let me just put this disclaimer. She's not here to give any medical advice or anything.
Exactly.
But I grew up with fairly pretty skin. Like I've always been told, you have pretty skin. And I noticed that my skin was changing essentially when I first moved to South Carolina. I was like, what is going on? Where's the girl with the good up skin? All of a sudden, you're seeing different spots on your face. And I went to my dermatologist, and I will tell you, all she did was sat next to me, looked at my face, and essentially basically told me, no, we're going to change your skincare routine, essentially. So I have to, and she prescribed me tretinoin. I hope I'm saying the word right, because yeah. Without basically telling me, she just said, you have some little hyperpigmentation here, or you have some spots here, this is what's going to use for it. And I was like, okay. But at the time, my face was so bad that I didn't even care. I didn't even research literally what tretinoin does or what it is. I mean, I had an idea, don't get me wrong. But so no, my skincare routine is simply a Cetaphil face wash, sunscreen. I will talk about that later on as well. But sunscreen, and then my facial moisturizer, which I use the CeraVe moisturizing cream in the mornings, and then at night, just those two steps. I mean, along with the tretinoin. Yeah. But I found my face essentially I'm seeing improvements, don't get me wrong, but it was much more drier. So I'm starting to add in the hyaluronic acid because I was used to doing that. But saying all that to say, like, what are some unique concerns that Black women or people with melanin-rich skin should be more mindful of? Because bear in mind, some of these products are not necessarily made with us as Black people in mind. So you have to be mindful essentially as to what we're using. But what are some concerns that you think we should be more mindful of when it's related to our skincare?
Yeah, I think one of the things, the whole statement, Black don't crack, like you say, we do age amazingly well. And, that's just one of the amazing Black girl magic things that we have, which I love. But it means that sometimes we do neglect our skin because Black don't crack, but it will eventually age, unfortunately or fortunately, okay? Aging is definitely a blessing, but you are going to make yourself look worse in the long run if you're not investing right now and putting the time to wear your sunscreen every single day. This is the thing I come across the most probably, is that Black women, we don't think we have to wear sunscreen. And that is like the biggest mistake that you can make, because the sun equals damage to your skin, and damage to your skin equals wrinkles in the long run. Not necessarily now, but in 20 years when your friend who's been using sunscreen every single day looks amazing and you're like, why does my skin not look that great? That's going to be why. The other reason is we really suffer with hyperpigmentation so much. It's the thing I hear about the most in my clinic. It's the thing I hear about the most on my social media DMs. Hyperpigmentation is the biggest struggle, and the sun's rays is going to make your hyperpigmentation so much worse. So you need to wear your sunscreen every single day, okay? That is just like the number one thing that I just keep banging on about.
And I want to chime in here because I had that same naive thought. I'm Black, we don't need to put on sunscreen, or we'll only put it on when we're going to the beach, essentially. No, I don't. A day doesn't go by where I'm not wearing it in the day. But I've had someone, I was trying to tell him, essentially, you should be wearing your sunscreen every day, especially when you're going to work in the day. And they will tell me, oh, I'm just running from the car to the house, or, vice versa. Oh, it's cold wherever I am, so why should I put on sunscreen? The sun is barely out, or even if the sun is out, it's not really hot. So to tell us a little bit the science behind essentially why it's important. It doesn't matter if you're running from the house to the car, just to the trash, whatever it is that, we should really invest in essentially wearing sunscreen. Because again, a lot of us have the mindset of Black don't crack, I'm fine. All I got to do is just put on, do my other skincare products, but just leave out the sunscreen. So let us know exactly why it's very important, especially as Black women, for us to wear sunscreen daily.
Yeah, so the sun's rays made up of two basically different wavelengths. You have UVA and you have UVB, okay? And UVA is going to get through the clouds. She's going to get through the window. She's going to get through everything. This is the point. And I think the stat is about 80 or 90% of UVA rays gets through the clouds. So even if it's a cloudy day, you still need to be wearing sunscreen. Sometimes you can look at the UV index, and if the UV index is super low, then maybe you can skip it. But generally, to me, my advice is don't faff about without all that. Just wear the sunscreen every single day. Find one that you get along with and just wear it, because more often than not, you're going to need it. And, if any of that, like I said, the clouds will block that UVB, but any of that UVA gets in to your skin, it's going to cause the damage. So it's really important. And, not just for cosmetic reasons, but for health reasons as well. Skin cancer is rife. It's like, I think the third most common cancer out there at all. So it's really important that we all, whatever color we are, just protect our skin.
Yeah.
Super important, yeah.
But does it matter? Because, sometimes on the sunscreen, you'll see SPF 15 or 30 and all these other numbers. Does it matter? Does the number really matter? Or it's just like if it's 15, it's less potent? I don't know. Help me out here.
So I generally say, try and go for SPF 50. The difference between SPF 30 and SPF 50 isn't that great of a jump, but I just think giving yourself the maximum protection that you can is best. I think I would always say people to skip SPF 15, but going for 30 or 50 is going to give yourself the maximum amount of protection, basically. So that's what I always advise.
All right. So then I want to talk about the idea that there's a lot of one size fit all when it comes to skincare routines. Because for me, I'm on my TikTok girlies, my YouTube girlies, I'm seeing the 1,000,001 step that they have face looking like glass. But for me, there was a point in time, honestly, if I can be honest, that I was a bit insecure about my little 3-part, skin routine. Cetaphil's face wash, sunscreen, and moisturizer. Now, like I said, I've added hyaluronic acid to it. But for those of us who think that, we see our favorite influencer, she has 20 steps of products that she's using before she goes to bed or in the morning. I was telling myself the other day, I was like, you know what? My skin is really looking good. Essentially, one, I'm more hydrated. So I want to talk about the importance of water as well. That's one. But two, my skincare routine is very simple. Although sometimes I've had the urge to go and follow, I see this girl, her skin is looking really nice. We can have similar skin. Let me go and follow that. So what recommendations do you have when it comes to individuals who are following their favorite influencer, buying all these products that aren't necessarily cheap? But how can we essentially understand or learn like what works for our body? Of course, again, trial and error, I get that. But should we really be using 15 products for a nighttime routine or morning routine?
Yeah, I'm really not a big advocate personally of these 12-step skincare routines. I think a lot of it is quite performative for social media, if I'm being completely honest. Most people, and I think the vast majority, even if you have conditions like acne, you don't need a 12-step routine. In fact, the 12-step routine is probably going to be more counterproductive for you rather than helpful. And there's a lot of overconsumption, a lot of consumerism going on. For me, I always think if you struggle with your skin, keeping it simple is always going to be the best. And just making sure you're consistently using products that work for you, but things that we know work, like retinols, and using them consistently, making sure you're hydrated, not overcomplicating it, because when you overcomplicate it, that's when you start to break out. That's when you start to have issues. That's when you start to damage your skin barrier. And we have another host of issues. So really, less is more. Find a few products that you get along with and you're happy with. And if you want to boost it every now and again, treat yourself to a lovely facial if you have the means, but don't be purchasing, people are going into debt purchasing every skincare product, right? It's just not necessary,
No, I love that you said that, because I've seen so many different people. And again, sometimes you become insecure, not just myself, but people in general. Because one, I can't afford these products. But I like when you say less is more, because I think we need to understand that less is more when it comes to our skin.
For sure.
Now, we do focus on our face a lot. Whenever you hear someone talk about skincare, it's never necessarily the entire body. It's more so, my face is this, my face is that, right? We know, or if we don't know, the skin is our largest organ when it comes to our body. And many of us, including myself at one point in my life, we don't necessarily treat it in the way that we should to an extent. So how would you say taking care of our skin can impact our overall health? Because I'm all about the whole woman wellness and ensuring that, what we put inside essentially will show on the outside. So how does
Mm.
taking care of our skin in general impact our overall health? Because most times we're just talking about our skin, face and neck, but then the other parts, this is like, okay, yeah, I'm just moisturizing. That's it. There's no like actual care towards that. So how is that working towards our overall health and well-being as women?
Yeah. So, yeah, it's interesting because body care is like very, very neglected generally. And our skin's health is super, super important. I touched on it briefly before about, if you don't take care of your skin, you don't look at your skin, it can be very detrimental. Like I said, skin cancer is rife, and it is a big problem. So if we're not looking after our skin, those are the implications that we can have if you're getting a lot of sun damage, you're not wearing your sunscreen all the time. Other things, our health is inextricably linked to our skin. There are so many disorders that we have where if you're unhealthy inside, it shows up on your skin. For example, if you have celiac disease, you can get a certain rash that shows up on your skin. And also we've linked poor gut health to skincare and acne and things like that. So what's going on inside a lot of the times is going to show up on the rest of your body and your skin. So taking care of your body and your skin, it's one and the same, to be honest. And I think that's something we should all really try and take out the time ourselves to take care of.
So are there any particular product you would recommend? And the reason why I'm asking this, because again, going back to our TikTok and social media girlies, now, you have certain brands that I won't necessarily call their name, but, you got to use this particular brand and you put it with something else to make it another thing again. Again, like, taking a shower is not going to be an hour job because at this point you're mixing or you're using different body care products, So what are some product recommendations, or I shouldn't say product recommendations. I don't want to put you on the spot either.
Yeah.
But for individuals, yes, we got to, let me reel it back in there. But for individuals who have, certain problem areas, what is on the, like a darker underarm, or, between the thighs, your knees, whatever the case may be. Because for me, again, TMI about myself, I've gained a few pounds. I may not look it right now as you can see me, but I have gained a few pounds. One of the things that I've noticed is my thighs are rubbing more than ever.
Yeah.
So, like, the thigh gap is non-existent at this point. But what I'm realizing is it's getting a little bit darker between then. I know essentially it's probably because of the friction to an extent. But for individuals who little pollen areas that we may have, darker elbows or, behind your knees or, between your legs, like what causes that? And is that something that can be treated, or is it a particular thing one can do essentially to help lighten that area? Or should we just let it, run its course or be whatever it is?
Yeah, that's another big issue that I get asked about a lot is hyperpigmentation on the body. We can treat it slightly differently to on the face as well. So it's definitely a good point that you bring up. I love, love, love to recommend glycolic acid for hyperpigmentation on the body specifically. You can buy it in the form of body washes, in body sticks. Body sticks are particularly good for the inner thigh hyperpigmentation. And when you get those little bumps that are a little bit dark as well, often that is called keratosis pilaris. Glycolic acid is 10 out of 10 for that. So that's always a big recommendation of mine. And also, utilizing physical exfoliation, which often we don't really recommend. But in something like hyperpigmentation, it can, and keratosis pilaris, it can actually be really, really helpful. So using it, don't go crazy now, okay? But using it and making sure that you're moisturizing as well in combination can be amazing. They can be really good. So those are the main things that I sort of will recommend for hyperpigmentation specifically. Often on your body, hyperpigmentation, like say friction, is a really big cause of that. But any place you have a scratch or a bite or a spot, unfortunately, in melanated skin, it's probably going to cause some hyperpigmentation.
No, I like that because, again, we don't often think about that. We just, let me just try something to lighten the area, essentially. But like you said, the glycolic acid, that is 10 out of 10 indeed. Well, how often should one use it in a week? Because, sometimes they'll tell you every other day or every day. What's the frequency that we should be essentially using glycolic acid, especially when it comes to those darker areas?
I usually say 2 to 3 times a week, sometimes on the body. It depends on the area. So, for example, if we're looking at something like your legs, they might be a little bit more stubborn and able to take the harsh chemical of glycolic acid a little bit more. So you can step it up. Whereas sometimes people want to try and fade their bikini area, then I'd say definitely step it down a little bit. Then we're looking at the sort of the 2 times a week area. So it's a little bit nuanced, but don't use it every day. And I'd say try at first 2 to 3 times a week, see how you get on. That's usually a safe bet.
All right. So now I want to find out, why is it important for us to see a skincare doctor? Mm-hmm. Or how does one know when they should? Put it that way. Because for me, I just went to go see my dermatologist here because I'm like, you know what, these 2 spots here, they're just not going anywhere. What can I do? You know, where did they come from? But for someone who may not have the means or even the understanding, because I know a lot of the times we go through this world, this life, because life is life but we go through this life not necessarily paying keen attention to our body, and that's just in general. Some people just don't have the luxury of having to think, oh, you know what, between my legs are darker, or this has happened to my body. They don't have the time to essentially do that. So how can one, what are some essentially signs and symptoms that something could be wrong with someone's skin? What are some questions they could potentially ask their provider? Or how would they know that, you know what, this is somewhat serious, I should go to the doctor to see what treatment I can get done, for to help clear something up, especially individuals also who may struggle with, severe eczema as well. Yeah. I know individuals who have to take, medication to essentially clear some things up. So, and that can also lead to body insecurity. So what are some signs or symptoms that we as women can look at to say, you know what, I should see this particular doctor versus my OB-GYN or my general practitioner, whatever the case may be? How do I know this is a skin-related issue?
Yeah. So, I mean, first and foremost, when we're talking about cosmetics purely, you can seek help when it's bothering you. If you have hyperpigmentation, darker inner thighs, and it doesn't bother you, then there's no need to do anything about it. There's no point rushing to solve a problem which is not a problem to you personally. In terms of other conditions that it's important to, when's maybe like a red flag symptom, we call it. If you notice, new moles, for example, even on, Black people, especially things like the palms and the soles, you notice new moles, they're large, they're getting bigger quickly, they're irregularly shaped, they're dark, they just look weird. It's really important for that specifically to go and seek help. And, who you go and seek help from necessarily isn't a crazy thing that we need to consider. As long as you're seeking help, you might go to your primary care provider and they're going to say, you know what? No, this is a dermatological problem. They'll refer you. Even if you go to your OBGYN, she knows derm. She's going to point you in the right place. So as long as you're seeking some sort of help, that's all that matters. Things like eczema, it's really dry, getting out of control. Maybe you're getting some cracks, some fissures, we call it. You're noticing, maybe you're getting some infection, some gold crusting. Those are the times, basically, when it's not normal for you in these conditions that you have, that's when it's important to seek advice. It may be that it's nothing to worry about. It may be something can be done about it. So that is a really good time to sort of seek some help.
And with that as well, what are some red flags we should be aware of when it comes to, choosing our aesthetic or cosmetic doctors? Because, for me, I think one of the biggest things, one who's going to listen. And I think that's kind of how I determine who's going to be my practitioner or not. Because if you're going to listen to me and show me that you're making some changes, essentially, then, I know we can essentially foster a relationship. But for someone who may be seeing their doctor, the gynecologist, and they're telling them, you know what, this is a dermatology issue, I'm going to refer you. Okay, we're going to trust that their referral is going to be amazing. But sometimes it's not always the case with some people for whatever reason. So what are some red flags, essentially, one can look out for, especially when it comes to choosing someone as it relates to dermatology?
Yeah, I think it's interesting because in the UK, for anyone who's just interested, I guess, it's quite nuanced when it comes to aesthetic and cosmetic procedures and skincare, that pretty much our laws and regulations around this is really, really poor. Anyone can administer Botox, fillers, things like that. So looking for the red flags is so important, especially in the UK, because literally you don't have to be a doctor to be doing these things. So I
That's
always,
crazy. Wow.
it's a problem. So I always talk about red flags because, people will go and they'll pay the lowest price. But this person is very unqualified, doesn't really know what they're doing.
Yes.
And then you end up in a really bad situation. So wherever you are, red flags are important to look for. I think in somewhere like the States where you don't have these dodgy laws and regulations and you're going to a medical professional, you're going to be better covered. But one thing I would say to look out for is if someone is pushing onto you a large amount of cosmetic procedures, where you're like, hold on, hang on, this maybe is a bit too much, especially if this is a private clinic, okay, that you've gone to get something purely cosmetic and you feel like, wow, they're really pushing a lot of things on me. Take pause and don't necessarily get something on the first consult. Go home, think about it, maybe speak to some other people, because some people are trying to make a buck.
That is true.
So, you're always going to have to be wary of those people, whether they're medically qualified or not. They're trying to run a business. So finding someone whose voice you can trust, and is not just going to be flogging you for money, that is like the most important thing.
No, I agree, because I know of an individual, but don't know them, but know of the individual, like back in Antigua.
Yeah.
There's a bunch of certificates on the wall. So to me, that's a red flag. Because if you have 100, like at least 50 certificates on the wall, then we have a problem. We have a problem right there. Because, how many classes or courses are you, like, to me, that's a red flag for me.
That's
and then when I look at in this particular situation, I look at how sterile the place is as well. Because that's, to me, that's also key. And it was not. And I think I wonder to myself, like, you made a good point. Sometimes people will pay the lowest money to get, a particular outcome. But talk to me a little bit about self-confidence as it relates to wanting cosmetic procedures. Because again, sometimes you can do a little nip and tuck, as they say out here, for whatever reason. That could fuel your self-confidence. And then I'm here on the other end, seeing somebody, oh, wow, that person's flawless, cheekbone is this, everything. And so just talk about how self-confidence, or even taking care of yourself in the most basic way that you possibly can as it relates to your skin, because again, you may not have the means to buy all the expensive products. The cheaper ones, essentially, you could probably do, if not as much as the 12-step routine that you have. But a lot of us, we have the lack of self-confidence, especially in our appearance, essentially, because again, we're in an era where everybody's perfect. Like that social media is portraying that everybody's is perfect. We don't know what goes on behind the scenes, even leading up to a procedure. But I just want to know, or if you have any advice for us we want to start taking care of our skin better. Because again, now that we know that, the environment essentially affects even our skin. That's a whole different conversation, But I often wonder when I see people who would, go to this particular person, the area is not sterile. So that should have been minus the many certification, fine. If that's going to make you feel okay and safe with them, that's your prerogative. But when the area is not sterile, then when you see people, I've seen on TikTok, people are going to people who are not even dentists, but they get in, what is it called?
Those like implant
veneers or something. Yeah.
And
it's like what does that say? And this is not even knocking anyone, to be honest, but what does that say about our self-confidence? How can we as women, particularly Black women, just find that confidence in who we are as people in general, but just embracing, we have different skin tones, we have different type of, what is texture of our skin, whether it's oily, combination dry, but how can we find confidence in that and just understand, what, I can nurture myself, I can moisturize my body, like you mentioned, in a way that's going to be fulfilling to me and not others. So let's talk to us about that, give us some little push towards that self-confidence.
Yeah, I think, like I say, it's really difficult in the age of social media because, like you say, everyone looks a certain way and we're all striving to be a certain way and look a certain way. And it's really, really difficult. And body dysmorphia is a whole thing in itself that we learn about when you train in aesthetics. that there are certain people that are going to keep coming to you and you're saying, no, this procedure is not going to take you here. It's not going to make you look like this. And you have to recognize when someone is chasing something that they're trying to completely change themselves. And it really is a red flag to a lot of practitioners. And we do see it from time to time. And it's quite, scary and sad. You have to sort of bring people back to reality essentially and show them that what you're chasing is not it's not necessarily going to bring you happiness. So I think when you're on social media and you're scrolling, it's really important just to take the time to, we talk about self-care all the time, but really take the time to nurture your mental health, nurture your mental well-being, and really put in the work. And the work goes away from traditional cosmetic procedures. It goes away from medicine, and it really is the psychological, work that you can do, the therapy, just to try and kind of love yourself and get to that place. And I think that looks different for everyone. I think it's really difficult to define and say how you can get there. But doing that work is going to, in the long run, be invaluable. And you really want to get to that spot where you're like, I don't need any cosmetic procedures. It's not going to make me feel better about myself. I want to look natural. I just want to enhance my natural beauty. I want to glow as me. That's the goal that I want us to get to, rather than I'm going to try and look like this box that social media says I should look like.
Yeah. And in the theme of wanting to get procedures that's going to enhance a glow, what can you tell us within your scope? Like what type of procedures can we do to essentially maintain some level of still looking natural? Because for me, one of my things is I often say, if I can get my eyebrows, what is it called, microbladed, whatever, because if I can get my eyebrows done, the world is going to be sick of me, because I'm going to be that, you won't see me everywhere once I can master, right? Because I'm still learning, by the makeup, but I'm not there yet. But I have considered, getting the eyebrow aspect of it. So what are some things that we can still do that are still natural looking, that can just enhance our appearance without, drastically changing us the way I've seen it happen? So just, a little bit, give us a little bit tea about that.
Yeah. So I actually really specialize in doing natural treatments. I personally don't like doing treatments that is going to make you look really, really different. I really enjoy natural treatments. It's really definitely on my vibe. The things I love, so in terms of your skin, doing things like microneedling can give you the most beautiful glow, and it also promotes collagen as well. So if you're doing microneedling, if you want it specifically to try and fade hyperpigmentation or things like that, then you can do it once a month. But say getting a little microneedling procedure once a quarter is such a small thing that you can do to give yourself a bit of a collagen boost and be able to allow your skin to really glow. That's for my girlies who want to stick on the skincare route and they don't want to go into the world of injectables, something a bit more simple and not super pricey. That's a great one. When I look at my skin from when I was really getting microneedling, I was like, just life gets life and you just get so busy, even though I have these things at my disposal, I just don't do it.
Yeah.
But when I look back at a picture, I'm like, damn, I was really glowing. You know what I mean? The other thing that you can do if you want to go advanced and you want to go into the world of injectables, a great place to start is something like skin boosters, especially for the people in the 30s category.
Me,
where
okay.
I currently sit myself, okay?
Same.
So skin boosters it's almost like injectable moisturizer, we call it, even though it's not really. But it's a solution with some hyaluronic acid. Some of them have a different type of hyaluronic acid to fillers, the way it's made, and amino acids and things like that. And we inject it kind of just under the skin, helps boost your collagen, gives you a gorgeous glow. My favorite thing to do for myself personally. Because, if you're not wanting to do Botox and fillers and things like that, this is such a nice way to give yourself a glow, a bit of a boost every now and again. Honestly, never do it more than 6 months. Don't do it too close. You're wasting your money. But, it's a little treat every now and again. You actually can't go wrong.
Yeah, no, I love that. I am going to look in, because I have thought about the microneedling, but is it painful? I don't know. Should I get it? But I am going to look into that, because again, I need to have that glow, because I'm approaching the mid-30s, sadly.
It's
in the next
it's such a tough time.
And you know what? What's one thing I was saying yesterday? I said nobody, because I was looking at my skin. I was like, girl, no, they don't prepare you for how your skin also can change, especially in your 30s. You know,
Mm-hmm.
so I think it's probably wise that some of the things that you mentioned, you think that we should be doing that in our 20s so we can prepare,
Yeah.
because you know our body goes through different changes. And I was like, well, they didn't tell me my skin was going to look this way. So of course, you know, you got to be more mindful now. So
Yeah.
I
And
can
the other thing that
appreciate that.
happens is the post menopause, the perimenopause phase. I
Yes,
get a lot of
yes.
women talking about, no one said my skin was going to be now messed up in the post perimenopause phase. Really dry skin. A lot of people with hormonal fluctuations get new onset acne. And just having the knowledge and knowing that these changes may be coming lets us just be more prepared and more armed to deal with it. So yeah, like I said, always seeking help when you need it. But yeah, it's tough times for us women. It's tough times.
No, it is. But since you touched that really briefly, because you're speaking to my heart, for people who are, you know, going through the post-perimenopausal phase, like what can they do essentially to maintain that level of, you know, moisture, you know, the skin, you know, could become more loose? Like what can they do? Because again, sometimes we tend to forget that aspect and, you know, we try to focus on the whole woman. So what are some tips you can just provide, some brief tips to them about how to take care of their skin going through
Yeah.
that process? Because that's a whole different world.
Yeah, it's difficult. I think when you get a little bit older, it's very nuanced. Depends from person to person, because if you're quite far down that track and your skin is really suffering with sagginess and loss of elasticity, sometimes more intensive treatments are going to be more helpful. So that's when I'm going to need you to come into the office. Maybe you need to look at things like that go beyond, a little bit beyond facials, you know, lasers, things like that, you know, without getting too complicated. But that's when we're going to need to see you in the office. Okay. Sometimes skincare can't take us there. Equally, sometimes some women have to then start even looking at surgical options, which, you know, is beyond my scope really.
Interesting.
But
Yeah.
I sort of refer people on and like, right, I think that we've reached the limit of what we can do here. But for the women where you start to notice, okay, my skin is just it's doing too much, I don't know what's going on. You may notice some dryness as you hit the perimenopause, postmenopause phase, and you need to really focus on hydration then. You're not going to be able to use the 20-year-olds who are putting glycolic acid 10% on their faces and seeing no problems. That's not going to work anymore, okay? Focusing on hydration, finding a really thick moisturizer with ceramides, with peptides is so important. And if you're experiencing any acne, then, you know, using things like retinol, but not too strong a retinol, that's going to dry you out. It's a delicate balance. But yeah, I'd say moisture is like the big key takeaway.
Well, thank you for sharing that, because I'm really glad you did, because again, we tend to forget about that aspect. You know, every stage is going to be different. Every stage, I say, if they told me this 10 years ago, I probably would have been doing something else different in preparation for my 30s. But you know what? We here, we live and we learn, and we have practitioners like you who are here to educate us as well. Before you go, because I know you have a long day, are there any trends or fads that you think about that people should stay away from or maybe run towards? Because you know, there's always something out here in these streets.
Yeah, generally, I'm not a fan of the trends. The one thing that I'd say is up and coming in aesthetic medicine and just skincare generally is the use of regenerative aesthetics and skincare. Really exciting. We are combining finally like science with beauty, and the things like people using growth factors in their serums and us being able to use something like exosomes in the office. It's without getting too complicated and going too in depth, basically using things like growth factors, which are going to help promote collagen, promote elastin, and really give you a plumper look, and using certain delivery systems that are going to be really, really effective in the same way that we use like PRP, like the vampire facial, and just basically that concept, but in a more effective and efficient way. Really cool. I'm using it in skincare, which is like really, really cool as well. But generally fads, like putting food on your face, crazy work. Crazy work. I've been seeing the morning shed routine on social media where people are like peeling off like 20 layers.
Yeah.
Like,
I've seen
Just
that too. And I was like, that's too much work for me as it is in the
too much work for
daily.
me. Okay, it's not doing anything as well. So just stay away from trends. Always keep a very keen eye. Take everything with a pinch of salt. Always be skeptical whenever you see anything on social media. That is the main thing.
And for people, again, who are, again, the influencers are showing us one thing, and, the algorithm keeps bringing up certain things. How can people stay informed without feeling overwhelmed? Because I know you're on social media, you're providing the education for free, might I add.
Yeah.
The knowledge that you're giving us, honestly. So how can we stay informed without feeling overwhelmed? Because it can be a lot to try to decipher, okay, what should I run to? What should I not? Who's telling the truth? Who's not telling the truth? So how can we stay informed, but also try to not be as overwhelmed as it can potentially become?
Yeah, I think that's a really tricky one. I think making sure that the people you're listening to, I'm not opposed to the skinfluencers as a concept, but still making sure you're taking advice from people who are qualified and have the qualifications, the estheticians, the dermatologists, the cosmetic doctors, making sure that what you're consuming is actually from someone who has the credentials. Yes, if you want a recommendation, take it from your favorite skinfluencer, but don't necessarily consume everything you see and take it on, because you'll just end up being so overwhelmed. Sometimes I'm overwhelmed and I'm like, Nicole, you know what's right. I'm watching something and I'm like, oh wow, what? And I have to slap myself and be like, no, you know the information. What are you doing? But it's a lot.
Like,
so
it can be a lot. It really can.
Yeah, try not to get overwhelmed and just make sure you're listening to the right people.
All right, Dr. Nicole, it was a pleasure having you here, hearing that accent. I'm going to talk about it because I get it all the time about myself. But before you go, tell us two things. What is a non-negotiable for you when it comes to skincare?
Oh, okay.
For you.
Me personally, or just for the people?
Both, because we nosy here, so we want to know what you're doing and then what the people can do.
For the people, the non-negotiable is SPF. I don't want to hear it. If the people that come into my clinic and they're not wearing SPF, I'm like, please, guys, please. So non-negotiable for everyone else. And the consistency is also the non-negotiable, because you can't come in and then you're not using it consistently. And I told you last month to please use it consistently, and then you're not.
Here we are. Like, why am I wasting my time?
Yeah, exactly. And I'm like, so many of my patients, they get in the like naughty books, bad books, because I'm like, guys, you need to listen, please.
Talk to me, you're dragging me in my own podcast, because I'm like, okay, whatever you say. Let me get...
Please, come on.
Because sometimes I promise you, I am just so lazy sometimes that I'm like, you know what, I'm just funny. I did that last week and I was like, girl, I say, you know what, you're just going from the car to your house, and I didn't wear sunscreen and I felt guilty for the entire day. I said, you know what, no, this is not it. This is not even you. But I was running late and I was like, you know what, it's just one little thing, I'll be okay. But again, wear that sunscreen, because as you say, everything can still penetrate. It doesn't matter how gloomy a day is, there's still that UVA we have to consider. Well, thank you for being here in the tea tasting room. Fun fact to my people listening, when I reached out to Dr. Nicole on Threads, my big thing is always social media. While it can be a bit toxic, it honestly can be used for good as well. And I reached out to her. I'm always having my fingers crossed, and she did say yes. So we've been waiting to record this episode. But however, I discovered something back in December. She was going to Antigua. Turns out my good sis here has family in Antigua. So I said, no, it was just meant to be, because I'm from Antigua. It was just honestly, it was honestly meant to be. But I also, before I let you tell the people where to find you, I really want to commend you. Honestly, thank you for the work that you're doing, in your community in England, but also just on social media, because it's very hard to decipher what is good. And your threads are just sent with some sort of peace and comfort, at least for me. So I want other people to come and discover you on social media. I'm being for real, because again, I have this, I tell myself, I could be lying, I have this talent for discovering when some people are just posting things for the sake of going viral, or wanting to be seen, but it's not genuinely, let me actually educate, or let me actually tell somebody, if I'm living by this is how it works. No, you just want to go viral, you want to get, whatever paid, do you, if that's what you got to do. But it's just always really nice when I come across someone who I can the energy, and people say, Tanya, how can you feel energy over text? I say, girl, I don't know, but it's just, It happened. It happened. You feel it. So definitely, it means a lot for you to even take time out of your busy schedule to even respond to my email, to even tell me, you know what, I'm going on vacation, but when I come back, let's do this date and these different things. So that, that's just really heartwarming for me. And I hope you'll come back on the podcast in the tea tasting room in a different capacity, talking, more in depth about other things. But definitely want to thank you for being here in the tea tasting room, and let the beautiful people know where they can find your beautiful face. Because guys, you cannot see her face, but the skin is over here skinning. The teeth is just giving perfect, she is really, she really is beautiful. But let the people know where they can find you on social media, how they can connect with you.
Sure. Well, thank you so much for having me. I really appreciate it. And sometimes, when you're trying to educate via social media, it gets very difficult and overwhelming. And we also are humans, so we get bogged down with the numbers too, right? So that's really, really lovely to hear that you enjoy the content and the threads as well. So thank you for that. That keeps me going, because sometimes I'm like, I can't do this anymore.
No, I know, but you're doing a good thing, honestly, for free. Let me add that part.
Yeah, for free. But the people, we're trying to educate the people and educate free. So my Instagram is at dr.NicoleJ. Spell out all the way DOCTOR NICOLEJ. That's the Instagram, and
it'll be in the show notes. We'll put it in the show notes.
Dr.NicoleJ in Instagram and TikTok and YouTube as well. So I'm just trying. I don't really know how to make content, but I'm just trying.
Well, if you don't know how to make content, then what say me? Because you out here killing it, honestly, and I mean it too, because we need it. We need more of you. So even if you're discouraged, just remember what Tanya says, because, the education is important, and people are learning, people are asking questions. So that's very important. Again, thank you for joining me here in the tea tasting room. I look forward to seeing you again here.
Thank you so much for having me. And I would love to be back. It's been a lovely experience.
Thank you for joining me for another episode of Tea with Tanya. If you like this episode, be sure to share it with a friend. Don't forget to follow on Instagram at Tea with Tanya Podcast. Be sure to subscribe to the weekly Tea Talk newsletter. And of course, rate on Apple or Spotify and subscribe wherever you listen. See you next time. I love you for listening.